Hi everyone. So from VP platform, today's topic which we are going to discuss is under psychological disorders, that is mental retardation. So mental retardation is one of the childhood psychological disorder. So I'll be explaining what it is. So retardation means having or deteriorated level. So retardation of a mental ability is called as mental retardation, where a child cannot make use of his mental ability at a proper time. Okay, so proper in the proper way, so that is retardation of mental ability. And the characters of mental retardation are poor intelligence level, so their intelligence will be less than 70. You may be heard about intelligence quotient. Intelligence quotient is a level of intelligence. A normal person's intelligence quotient will be 90 to 110. Okay, the percentage of intelligence quotient of a normal person is 90 to 110. Of a mentally retarded person is below 70. So that is intelligence level will be poor than a normal person. Poor adjustmental skills. So they'll be having problem in adjusting. So they'll be lacking adjustmental skills, and also it occurs at the childhood, preferably during birth only. So it starts, but the parents can identify the symptoms of these mental retardation maybe during the childhood, maybe from a third year to 5 years of a age. Okay, this is about the meaning of a mental retardation. Now we'll see the types of mental retardation. There are totally four types of mental retardation: as mild MR, moderate MR, severe MR, and profound MR. Even I have mentioned IQs of these MRs. So mild MR can also be called as educable, because with lots of difficulty mild MR can study up to third to fourth standard. Okay, and their IQ will be 50 to 70%. In general, MR IQ will be below 70. In specific, in mild MR, the IQ will be 50 to 70. Then the second type of mental retardation is moderate MR. They are called as trainable, and their IQ will be 30 to 35 to 50. So trainable means they have lots of difficulty in education, but they can be trained in few basic or few simple tasks. Okay, every day they should be trained in a same or a similar kind of task, then they will learn it better and they can do it. And all of a sudden changes in that particular work, they cannot catch it, so it will take lots of time. So training a same simple activity that they can do. Okay, then severe MR. Severe MR are also called as dependents. So their IQ will be 20 to 35. Dependents means they need a supervision all the time for all kind of activities. They cannot do any of the activities independently. So even for the basic like taking bath or maintaining their personal hygiene, doing some cleaning, so they need some other supervision, but they can learn it with lots of difficulty, with lots of supervision. They can learn it. Few things they can learn. Then fourth one is profound MR. They are completely dependent. Here at least severe MR with the supervision they learn few things, simple things. But profound MR they are completely dependent and their IQ is below 20, and full time supervision and full time they'll be dependent on one or the other person for each and every activities of them. So these are the four types of mental retardation. Next we'll see the symptoms. Symptoms are low level of understanding. As their intelligence level will be less, they will be having understanding level also poor. So their understanding level will be poor. They cannot understand the things clearly. And poor intelligence below 70. Their IQ will be below 70. And poor concept of hygiene. So they cannot take care of their hygiene by themselves. So they need somebody else to help them. So hygiene also will be poor. And lack of proper toilet training, they cannot understand. If you train them also, they will take lots of time. I think at least mild and moderate can understand, but severe and profound it is difficult for them to understand the training. Then they won't be having a lack of color concept, lack of number concept, lack of money concept. So like color concept, they can't differentiate the colors. They can't make out the numbers, which is a big number, which is a small number, and also money concept. They cannot make out what is the more amount, what is a less amount, which has a more value, which has less value, that cannot make out. And poor academic performance, as as their IQ will be low, as their understanding level will be low, so their academic performance will be poor. They cannot score a good marks as they cannot understand what is taught by the teachers. Temper tantrums will be there, so they'll show lots of anger, irritability, and they'll disturb everybody, even at the school, even at the home. They cannot adjust with any of the kids, they cannot adjust with any of the elders also. So pinching others, beating others, abusing others, fighting with others, so lots of temper tantrums. And even they'll be having poor adjustmental skills, so having problem in adjusting with others also will be there. Causes. So causes of these mental retardation are pre and post delivery complications, birth complication, and chromosomal abnormalities. So birth complication, pre delivery complications, like when a kid's mother is pregnant, so she may be having some health issues, she may be on the regular medication, there may be some chronic disorder for the mother during the pregnancy, she may be having very stressful lifestyle, she may be having a very poor nutrition of a food, and there will be lack of proper follow-ups with the doctors, or else sometimes the pregnant lady may be having some habits, maybe she is taking alcohol or is doing smoking or gutka, tobacco, that also influences over the brain of a kid. And even post delivery complications, like just after the birth, the kid may develop some childhood issues, some disorders, some may be like epileptic issues, so that also leads to mental retardation. And even birth complication, that is during the birth, so maybe a normal delivery or cesarean delivery, or any issues during the birth, any issues during delivery, or birth cry was delayed or birth cry was absent, that also influences over the kids behavior or kids health. And then chromosomal abnormality, so chromosome is present in all the living cells. It is a thing which carries what can say genes through the chromosomes. Okay, and these chromosomes, preferably there will be 23 pairs of chromosomes, that is 46 chromosomes will be in each person. One extra chromosome or lack of one chromosome may lead to chromosomal abnormalities, that also results in the psychological disorders. And then at the end, the treatment. So treatment, medications will be given. Medicines are given not to increase the level of IQ level, not to increase the intelligence level, to handle the abnormal behaviors. Medicines are given, so where the MR persons cannot like judge like what kind of way, in what way they should show anger, in what way they should show aggression. So they'll be having some other temper tantrum, some other judgmental issues, some other behavioral issues. So to handle those things, medications are given. Then behavioral therapy is given to teach them few things. So under behavioral therapy, there will be token economy, chaining, shaping, and different kinds of therapies will be there, that we'll be explaining in another video of psychotherapy. So behavioral therapies are given to change the maladaptive behavior. Then special education is very much important for the kids, just for the sake of parents, like parents doesn't want the kid to be in a special school, only for the sake of that, if you put them in the normal school, it will be difficult for them to understand what is happening in the normal school. So special schools can treat them very well, so they will be the teachers in the special school, special educators will be knowing how to handle these kind of kids, how to teach these kind of kids. So it will help the child to grow much, it will help the child to learn much. So special education is important, medication is important, and behavioral therapy is very much important in a MR kids. So with this, I will be going to end the session of mental retardation. If you find all our videos informative and helpful for you, please subscribe to our channel. Thank you so much.